Hey everybody, this is Dr. Daniel Choi from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center, and I wanted to answer a comment I got on YouTube the other day. They're asking me about the process of how we do all-on-4 at our office, and I guess they were like mortified about coming into the dental office, so they wanted to get as much information up front. So decided to create a video about this and really kind of like let people know what expectations are typically if they go in to get an all-on-4 done, or just kind of let people know how we do it. It's actually a common question I get during consultations, so I figured I might as well knock this out with the video. All right, before I proceed, please give us a follow and thumbs up on this video if you think its content was worth it, and also give us a follow on Instagram and Facebook. We are definitely posting a lot more, some before and afters, showing people some of our cases, letting people know about kind of like our staff, what we're doing, also the daily feed. We're going to keep that updated. So it's a lot of work, but we do want people to have kind of like insight in what we're doing every day. All right. So jumping into this topic, right? So you want to do it all on 4, or if you're considering it, step 1, give us a call, right? We'll book, or you can actually book online. And you set up that consultation. You come in. So what happens the day of the consultation? You actually do, first things first, we get a 3D scan on you, and I'll show you what that looks like. So here we go. This is your traditional panoramic x-ray. The 3D scan is this one. And this is actually an example. This is a patient. I'm doing her upper and lower jaws tomorrow. This patient is lost a lot of bone. She's been a smoker her whole life, periodontal disease, pretty big infections. Not really happy with her aesthetics. And so at this point she says, like, let's do an all-on-4. So really excited for her. Really excited for this case tomorrow. But anyways, first thing we do when you come in, consultation day, we get a 3D scan on you. And this is, I mentioned this on another one of my videos. If somebody wants to do an all-on-4 you and they're talking to you about an all-on-4 and they don't have a 3D scan, or they say they don't need it or whatever, just run. Literally. There's nothing to talk about anymore. Just run. They don't know what the hell they're doing. Okay, so hopefully that was a good piece of advice. But anyways, yeah, this is a very critical piece of information that you need before you do any surgeries. And again, this is a traditional panoramic x-ray. This is helpful, but nothing nearly like a 3D scan. But anyways, just again, here at our office, what we do is we get that 3D scan, then we get you seated. We will then proceed to get some scans of your mouth, right? So these scans, we have what we call a digital scanner. And long story short, you know how like you go to the dental office and they get that gooey impression of your mouth? That gives you basically, we can then use to replicate what your teeth look like, your teeth and gums. Well, now we can do that digitally. Now, sometimes we still do get an impression of your mouth. But we will then take that information, that digital information, and we will overlay it with that 3D scan that we just took, right? So it's really cool. So again, we get a replica idea of like what your teeth look like, your teeth and gums look like with that digital impression, and then we take that 3D scan and we overlay it, okay? Then I'm gonna take that information and it's gonna be very helpful for me to plan that case. But before I go into that, actually let's talk about continuing day 1, right? So we got all that diagnostic information. We look at your mouth and we say, hey, are you even an all-on-4 candidate? Now, most people are, but there are some people who are not all-on-4 candidates, so we just want to let people know, at that consultation, again, whether you are. And that's going to be whether you just lost an insane amount of bone, or certain medical factors come into play, or just medical factors. That's pretty much it, right? So we'll tell you whether you're a good candidate, or maybe we think that you not going into an all-on-4 is the best recommendation for you. Maybe there's a way to salvage your teeth. Maybe we can do some crowns or something, or individual implants. We have some patients that come in, they're interested, but it's way too early in their life and they're definitely not a candidate. And we just don't want to do any damage to any patients, right? So there are some patients that aren't actually candidates in that sense too. Anyways, so during that consultation, that's your opportunity to ask us as many questions as you want about the process, what your teeth are going to look like. But that's it. Anyways, so after that consultation day, we basically are going to plan your surgery, right? So we're going to take that information from the scan and the digital scan and the 3D scan that we took, and we're going to prepare for your surgery, right? So what are we really looking for? Hopefully this information is helpful, even for anybody that's going in for a consultation anywhere. But certain things I'm looking for are, where's your inferior alveolar nerve? Where's the mental nerve? Where's your sinuses? How thick is your bone? I can literally look at your 3D scan real quickly and see, how thick your bone is. All these like certain factors that come into play. So that's some diagnostic information that we use to be able to plan your case. Now, typically at our practice, we're booked out a few weeks. So we book out your surgery day, the day of your consultation, and then you come in for your surgery day. So we're going to go over some instructions with you because we're going to sedate you with IV sedation. Another piece of advice, this is a pretty major surgery, so if anybody recommends just oral sedation, again, run. You definitely need a deeper sedation than that. So for you to be comfortable for this procedure and not have an experience where you were awake the whole time and it was traumatic for you, make sure you definitely get IV sedation. We actually have a video that talks about the difference between IV and oral sedation, so I'll link that above. So hopefully that information will be helpful. But anyways, we'll give you instructions even before you come to the surgery, what you need to do the night before in regards to eating habits. And then also you come in for your day of surgery, make sure you have a ride. We're gonna, first things first, you come here, we're gonna put you to sleep, and then we're gonna, if you need teeth to be taken out, we take out your teeth, we place your dental implants after we smooth out your bone. Again, we do have to smooth down your bone because we need to create enough space for this prosthesis. Make sure that you have enough space, and make sure the aesthetics are gonna be good. So we're gonna smooth out your bone, we're also gonna place those dental implants. After that point, so we do things like, pretty differently here at this practice where the digital dentistry advantage really takes over. I have another video talking about that, so I'll also link that above. Really cool. In all honesty, I gotta tell patients, listen, this digital dentistry change that we made in our practice from last summer, I think it was June or July of this practice, is the biggest advancement in all four, in my personal opinion, since it was invented in '98. We did it the old traditional way with something called the chair side conversion. Long story short, it was a pain in the butt. Because you're taking a denture that you converted into an all-on-four prosthesis, it's essentially like patchwork. The prosthesis, the teeth might break, a tooth might break, the prosthesis might break in half during that healing period over the next 5-6 months. So we got away from that. We did the digital prosthesis option where, long story short, we actually mill your teeth or we 3D print your teeth. And what that allows your temporary to be is a lot stronger, okay? And then you might be asking, wait, what are we talking about with the temporaries and stuff like that? If you guys haven't seen that video, I have another video talking about, some people who want to put you in your final set of teeth within 48 hours, which is an atrocity. Do not do that. Make sure you really watch that video. So I will also link that above. But it's in your best interest to be wearing a temporary. And again, I'm not going to go into details in this video because I don't want to make this video too long. Just make sure you watch that other video. But during the temporaries, the digital dentistry has really given us a temporary that's a lot stronger that the patient can wear. So anyways, so that's where the digital dentistry aspect takes over. So what we do after I do that surgery is we're going to get another digital scan of your mouth. We're going to get molds of your mouth. And then what we're going to then do is we're going to use something called photogrammetry to basically use the digital scanning system to know exact placement of how your dental implants are. And then that's basically where we dismiss you. Okay, so you get to go home, you go to sleep, and then you come back the next day. Now, some people say, wait a second, how come I'm not going to get my teeth that same day? Well, that's what we actually used to do with the traditional denture conversion method, with the chair side conversion method. But again, you start experiencing way more issues in the interim over the next 6 months because your teeth will break, all these things. It's a catastrophe. And also, what we could do is we can actually design your teeth on the software. So we actually have some CAD software. We basically design what your teeth are going to look like digitally. Then we mill or 3D print your teeth and we stain your teeth. But that whole process takes many hours. It takes at least 5 hours, maybe 6 hours, right? And because we don't want you sitting in that chair for another 6 hours, we don't want you to be uncomfortable. I could honestly tell you that the time would well be worth it versus the traditional chair side conversion, because the prosthesis is going to be so much stronger and you're just going to be so much happier over the next 5-6 months. But what we do is we don't actually want to rush that whole process, and we don't want to have to keep on sedating you for the next 5 hours. And then also we don't want to give you more drugs and then also numbing you up over that whole period of time, because at a certain point it's going to be unsafe for you. Now, not to scare you, but this is where I've heard of some incidences happening at other offices where there are medical emergencies because patients were sedated too much or patients were numbed up too much over the span of that day. So that's the reason why we actually have me come back the next day. So anyways, I went over this a little bit ago, but after I dismissed you, after I got the scan again of your mouth after the surgery, and I did the photogrammetry noting exactly where the dental implants are placed. After we send you home, that's where all the magic happens. Start designing your teeth on CAD software. We mill out your teeth, we stain them, and then again we bring you back the next day, and then we deliver your teeth. So you got your teeth in your mouth, you're gonna smile, and also we're gonna make sure your bite's right. So we adjust your bite, make sure your bite's right, and then we have you come back in another week just for another check, right? So just make sure everything's healing okay. And honestly, that appointment, if you want to skip, you can honestly skip it. But because it's such a quick and easy appointment, patients just tell me, "Hey, how are you doing? Like any questions?" And it's honestly not a question that people can't do over the phone, right? And then we bring you back in another month. And at that month, we actually unscrew your prosthesis from your mouth. We make sure that we clean the prosthesis for you. And then we basically take some x-rays, make sure the implants are healing well, right? So one thing that you'll know is you'll know if the implants aren't healing well typically in that first month appointment. So that first month appointment is a pretty important appointment just to make sure everything's healing okay. And also we just, again, clean your prosthesis and answer any questions that you may have. And then basically we just follow you up over the next few months. If you want, you can come in at the 3-month appointment, the 4-month appointment. Again, just take x-rays. We're going to clean the prosthesis, answer any questions. It's typically at that 5-6-month appointment where your bone and gum has shrunk significantly enough to make sure that everything is going to be good and you're ready for your final prosthesis. We're going to take into account any revisions do you want. How do you like the aesthetics? Do you want your teeth a little bit wider? Do you want them taller? Do you want them more ovoid shaped, square shaped, whiter color, darker color, whatever, gums, you want different color? So these are little nuances that you can just tell us about what your expectations are before we move on to your final set of teeth. So that's what we'll be doing on those final appointments. Also, I want to take another step back. I did make another video talking about post-op instructions, what to do after your surgery, what to eat, what your expectations should be. So I'll also link that above too. So hopefully that information is helpful. But that's basically the process we follow at our office. So look forward to seeing any questions that you may have below, any comments. And I, again, did want to accentuate the fact that how we do it with our digital dentistry at our office is going to be different from most other offices. I'm anticipating if you want to do an all-on-4, a lot of them are going to talk about the chairside conversion, which, again, no knock on it. That's the way that it was invented. That's the way we used to do it up until last summer. And I am so thankful that we switched over to the digital process because it is the biggest advancement and patients are just so much happier. Again, please watch the other videos I linked before. We even have a testimonial from a patient that went through an all-on-4 upper the old way and his experience, and then the new way with and that was with a different dentist, and his new way with us, and how much happier he was with it. So again, please feel free to leave any comments below. Give us a follow on Instagram, North Texas Dental Surgery, Facebook, and again, give us a thumbs up and a follow if you love this content. Thank you. I appreciate it so much.